But this is the piece that's got to come back to the fore of this maturing attitude towards what's happening sexually, is for people to be able to own the authenticity of their desire in a way that they can express honestly, safely, honorably, and consciously, you know, to themselves and also to their partners. So for the last number of years that I've been seeing clients, it's been clear to me that there's a lot missing in the therapeutic model that's being used and applied to support people in getting honest about their sexuality, becoming authentic, embracing this authentic part of who they are. And this is then left me to, on my own terms, I've got my own disorder I've defined now, and I call it sexual authenticity disorder. The fear of expressing or revealing one's authentic sexuality. I've seen hundreds of clients and led workshops with hundreds of people, and it's just about the same for everybody who's ready to cross that threshold and are right at it and haven't quite gone across. Or they've gone across, but because they have decades of fear and self-judgment about it, it's going to come right back up, even if they have started to explore a bit. So this fear, this disorder shapes itself by that fear, and I look at the therapy as pretty simple. It's support the desire, encourage the desire, help them differentiate and understand the desire in a real specific, clear way, and then untangle all of the sex negative journey that they've been immersed in up to this point. All the things they fear. The fear of, wow, what if my boss knows, or my partner, or my kids, or my parents, or the priest, or the minister. That is a scary threshold for many people to cross, to be witnessed in their authentic sexuality, because of there's so much judgment and fear in the culture that they're immersed in, that people, there are consequences for coming out, whatever that means for you. There are people who will abandon, ostracize, kick you out, fire you, divorce you. The courts will take things away from you. So there's a lot at risk, and that fear is tangible and real. So it is, and this is what I was speaking about you, to be the courage that you're showing, just to even show up in this class, this people have to come forward more to be able to advocate and encourage and bless people for who they are, rather than judge them, make them afraid, and keep them in confusion. You know, this total confusion about, well, am I fucked? Pardon my language. Am I messed up? I won't. Or, you know, how can I be healthy and have these desires, you know? So this is what I treat people for primarily, you might say, is just help them understand what's true for them and then untangle all that's resisting that truth. So I mentioned that I needed to come up with this disorder myself, because it's not in the DSM, not even in the newest one that's come out. And this is a point I want to emphasize as much as I can, and I believe you're probably already there, but just to emphasize it, how important it is to keep an open mind on your journey here into whatever direction you're heading in these helping professions to support other people. Because that's what they really need most, is just someone to listen to them and respect them for who they are. And right now, because this wave is just of sexuality has just run out so far, the therapeutic model, the sexual theories, the academic, institutional teachings are way behind the curve. And they're also what I think of as being in a funnel. You know, you step on this track to get to your career, and you get put in a big funnel that just winds down narrower and narrower and narrower, that traps you in things like, well, to do what I do, I need to be licensed, I need to follow the DSM-5 diagnostic assessment tools and all that in order to get paid. And that will inform me about what pharmaceuticals I can prescribe for someone. And we are also in this, there's a lot of entrenched beliefs and invested interests in this existing model that doesn't want to change, is going to resist you. So you have a lot of momentum carrying you in a certain way. And I believe this is a place where you need to really trust and engage your own point of view, your own thoughts, your own ideas, your own understandings. Because what you're going through this funnel might not be offering you what it takes to really go out and help and support someone in the real world. And I won't say that there is so there's value and there's things that are important that you're going to learn and come across in this path, but also be aware that there's a lot of narrowness and conservative views that aren't going to be, this is the frontier of human psychology. The human sexual unconscious is a wilderness area that's been yet to be explored, barely explored. So it's like the Wild West out there right now. So the reason this is important to keep an open mind, because everybody know what the beginning of this statement is? Do no harm.
First.
Yeah, first or above all, do no harm, from the Hippocratic Oath that all medical professionals take. And this is what I'm pointing out about this narrow-mindedness. This is sexologist Dennis Daly, and he says, too often those who experience the need or desire for help in sex-related concerns encounter helpers, and I love that he uses the term helpers, who reflect the harsh, judgmental, inaccurate, and narrow perspectives on sexuality which still exist in our society. And this is winding up harming the patient rather than helping them. And this was 1988, that quote was from. He was warning about this 25 plus years ago. And we're still right about there as a culture. Yeah, we don't know how to be yet inclusive and open to the diversity that is emerging and needs to be supported because it's authentic. Everyone has a right to be who they are. So the people that are emerging right now or have emerged and are out there, have been out there for decades, that are counseling people, couples, families, people on their sexuality or their sexual troubles, basically themselves have taken no training in their sexuality, in sexuality theory, and if they have, it's kind of outdated. And another thing that's important that doesn't happen, in my opinion, is the helping professions are not required to go through their own journey into their truth of their sexuality and look at what their own judgments and places where their edges are, which is fine. That's exactly where you need to be. But also then you can see, where am I projecting out onto someone else when I'm going, oh, that's sick, or that's disgusting, or that's weird, or how could somebody want to do that? It requires one to examine one's own prejudices if you really want to stay in a neutral place of support for the client. So a little further on that, let's put the DSM and the current academic model in perspective. It is theory, it's not science, it's not accurate. These are all theories that are the pre-existing ones, are theories which, if you look at the efficacy rates of most of the therapies that are offered, it's been a while since I've looked, but I was startled back at least a half a dozen years ago that it was about, if something was 30% effective, that was like a home run almost, as far as academic treatment models are concerned. A few can be higher, but some are less. So like these are, the way that is being offered as the treatments now, and also the diagnosis, is kind of a collective, yeah, this must be something bad, so we'll name it. You know, the DSM started in the early 50s with 106 disordered diagnoses. This current one of DSM-5 has over 300. So suddenly we've gotten 3 times as much mental health issues on the books as just 60 years ago. And I came across this, which was interesting to me, that the National Institute of Mental Health refuses to use the DSM because it's not valid, researched, scientific orientated. It's, as they say, clusters of clinical symptoms, not any objective laboratory measures. So again, this is why I want to encourage your open-mindedness, your own thoughtfulness to bring into the equation. So this is just to reiterate that there's a lot of new research, understanding, comprehension, expansion of the model to fit what's happening in the real world right now, because people aren't getting the proper care that they need that supports them in both being who they are and also healing from all the ways that they've been thwarted or discouraged or wounded around being who they are.